So these were the two articles that Alex referenced before, and they're essentially about talking about, well, what sort of change can we support in folks around either starting PrEP or adhering to their medications? And I really like the telemedicine aspect of it. Zoom has been a huge help in our work. Love the fact that you're doing trauma-informed care, and that's influencing and informing how you're approaching things. So if we take a look at, well, what makes people change? Well, we know information does not cause transformation, or we would all eat healthy. Nobody would ever smoke a cigarette. So we know information alone is not causing transformation. We know it's a process. It involves these 4 factors. So culminating obviously with behavior. So the key question then for me after reviewing those articles was, are these interventions addressing and integrating these factors in a process that supports behavior change? And a slight sidebar here is that the Gay Counselling Training Hub, we recently trained folks at the PrEP clinic. And in talking to them, we said, what is the greatest challenge that you come across? And that's folks coming in to get HIV testing. They ask them if they're interested in learning about PrEP, and they're getting these negative responses. Some of those folks subsequently come back and test HIV positive. So the challenge is, how do we engage those folks in a conversation around PrEP? And so that was the challenge that we found with working with them. And we sort of came up with a strategy that they're sort of trialing right now. And then if we shift back to what makes an effective counseling relationship, and this sort of addresses quality control. And so regardless of modality, say, therapeutic modality, the single most important factor is that therapeutic relationship between the client and the counselor. So it's that quality of connection. So that leads to the question, so what counseling skills are effective in producing that effective counseling? And we can say, and I think you touched on a lot of these, Alex, is that the skill level of creating that connection, the skill level of evoking the motivation and action towards change, and then that lived experience, which you cannot pay for at any school. And so safe counseling goes hand in hand with quality control. Are these interventions helping? Are they not doing anything? Are they maybe even harming? Is there gaslighting going on? Is that causing internalized gaslighting? Is there deepening trauma going on? So these are some of the patient safety aspects that came to my mind. And so finally, these are the 3 questions that I ultimately hoping that we can cumulatively sort of address and unpack is quality control in counseling in general. And what was the quality control in these interventions specifically? Same thing with patient safety in counseling, and then patient safety in these interventions. And then how, if at all, can we implement post-traumatic growth as part of these interventions?